Maniake, good morning, my Northern Rappel people. I am very happy that you all have tuned in today to hear our medical update and the concerns and the message that we want to give to you today uh, through during this pandemic and coronavirus. We all know that everyone right now feels coronavirus fatigue, that we're tired of staying home, we're tired of wearing masks, we're tired of social distancing, but more than ever, we need your help today. And we come to you, our Arapaho people today. I, Clinical Director Brian Olin, and our Clinical Chief Executive Officer are almost full capacity, that the hospitals are surrounding us in areas of Billings, Casper, Denver, Salt Lake, where our tribal members go to receive specialized care. Those hospitals are near full capacity with coronavirus cases. And so that is not to scare you, but it is to help us as a people realize we've got to do our part. And so we're asking our tribal members, remember the stay at home order that both tribes, Eastern Shoshone and Northern Arapaho, have put together. And in there is a wear masks in public mandatory statute. So we ask you again, our Arapaho people, even though you may be completely healthy 100%, and you feel that if you ever were to get the virus that you may probably be asymptomatic, no symptoms, we're asking you to wear your mask for grandma, for grandpa, for mom, dad. We're asking you to wear your mask for maybe your brother or sister who has diabetes. That's why you need to wear your mask. It's about your family, about our multi-generational homes that live together. We've all got to do our part and wear our masks every day. I know that we're tired and we don't want to wear masks, but we've got to wear them. And our non-Indians that come to the reservation, we plead to you today, respect our tribal law, respect the Eastern Shoshone and Northern Arapaho resolution, the stay-at-home order where you have to wear a mandatory mask in public. Help keep yourself safe and help keep us safe. So we're inviting you, please wear your mask today. And today I want to talk to the youth. I want to talk to the 16 to 30 age group. We really need your help. We've seen an increase in bonfires by youth, parties by youth that are on Snapchat, that are on social media. We need you to please stay home. Please remember your parents and your grandparents that you go home to after you're at these youth gatherings. That is very vital that you help protect your family at home. So we're asking you, please, no more bonfires, no more parties, no more passing bottles, no more passing sharing cigarettes. We really need your help today, our young Arapaho people. We know you can do this, and we have every confidence in you to help all of our Arapaho people. This is a team effort by all of us to help stay safe. Also, I just want to say a little bit more about sanitizing, social distancing. Let's continue to do this, even as we go into cold and flu season, November, December. I'm not a health expert or a doctor, so I'm going to allow our CEO Rick Brandon and Brian Olin to talk today about the medical and health concerns that we will be facing these next critical months. to help our Arapaho people stay safe.
So as we approach 600 cases on the Wind River Indian Reservation, we've learned a lot in the last 6 to 7 months. We currently have approximately 50 active cases, which is similar to what we experienced over the summer. 6 weeks ago, we were down to 10 to 20 active cases, but it has increased noticeably over the last 6 weeks. We know that our largest demographic of positive cases is the teenagers and young adults, the 16 to 30-year-olds. That's probably approximately 40% of our cases. So precautions in that group is especially important. We know that coronavirus has infected tribal members all the way from newborns. There have been newborns infected all the way up. And there's also, risk factors for coronavirus that we watch for: obesity, smoking, diabetes, many other chronic diseases put people at higher risk. However, there have been several young tribal members in the last month who have had severe complications due to a COVID infection. So it's not just affecting old people at higher risk. There are several younger members who have been hospitalized with severe cases. So the precautions now are important. We know that the events where coronavirus tends to spread are funerals, gatherings, parties, sleepovers, birthday parties, bars. Those are the places where we're seeing most of the transmission occur. We know that there's very little transmission in the local schools. There's very little transmission in businesses where masks are worn, in tribal offices where masks are worn. We're pretty confident that when masks are worn, there's very little transmission of the coronavirus. We're able to do this because we do the contact tracing, so we're in contact with many of the contacts and cases, so we've been able to collect data over the last 6 to 7 months. So we know that when masks are worn, social distancing is observed, hands are washed, and large groups are avoided, there is very little transmission and it decreases the risk substantially. Most of the cases that we're seeing spread happen in these small group environments, or people that attend these small groups or a funeral or gathering, and then they bring it into a home. And sometimes on the reservation there's very large families, and we can get a lot of cases out of one household, and that's what we're seeing over the last week as well. Yesterday was a spike for us. Over the last 5 days has been an increase in coronavirus. So the good news is we know how to prevent this. This is preventable. Transmission is preventable with these precautions. We've definitely learned that over the last 7 months. Testing is not unlimited. As the cases spike, we are unable to accommodate everybody that wants a test sometimes, and so it's extra important that we don't strain our healthcare resources in this county, whether it be the clinics on the reservation, the clinics off the reservation, or the hospital. So testing is not a substitute that prevents transmission. It's not a substitute for masks. You can test every day and still catch coronavirus pretty easily if you're not wearing masks. So we want to offer testing so we know what's going on. We can limit outbreaks, but it does not replace wearing masks in workplaces or in schools or even in homes. If you're concerned about anybody in your house, the best way to protect them is to wear a mask and wash your hands and distance.
When I was a little boy, my grandmother asked me, what does it mean to be Arapaho? What does Arapaho mean? And she told me respect and love. And that's what I'm coming to our tribal members today. The reason why I wear a mask all the time is because by wearing a mask, it shows that I respect and I love others around me. And that's what I'm trying to ask all of our tribal members is to continue to wear masks, especially when you leave your homes, when you go out in public. Always have your mask ready for you, so you can put it on. The Wind River Family Community Healthcare, we've been dealing with this coronavirus since the latter part of February, the first part of January, and there were significant outbreaks, and at that point in time we really didn't know what we were faced with. In fact, the whole world didn't know what we were faced with. And now that we're in the latter part of this year, we do know more, but there's still a considerable amount of information that is not known. Right now, I'm not sure if we went through our first phase or if we're in our second phase, but the coronavirus cases have significantly increased within the last month. And part of the issue is people going to bars, going to establishments where other people aren't wearing masks. The mask provides some protection to you, but the intent of wearing a mask is to protect your loved ones. It's to protect your family. And today, what I'm asking for Arapaho people and Shoshone people is wear a mask if you love your grandma, if you love your grandpa, if you love your children, if you love your great-grandchildren or your grandchildren, wear a mask. Because wearing a mask shows that you care about others, not just yourself. And that's why I'm asking everybody to wear a mask. But also, if you have a mask on and then everyone else around you has a mask on, you can reduce the risk of being infected with the COVID-19 or the coronavirus. But I want to emphasize again, those are our two highest values: respect and love of each other. And by wearing a mask, you're following our values, you're exhibiting our values, which is love and respect each other, help each other. And our old people always prayed for a good long life for everybody. And with us being vigilant and following through social distancing, wearing masks, wash your hands for 20 seconds, and do not go into large gatherings, because that's the highest risk that you can experience. It's been a very difficult time. We have lost 14 tribal members to this evil virus. And a lot of our elders, we lost them because their younger family members were out partying, are out doing different things outside of the house, and then they get infected out there, out in the community, and then what they did is they brought the virus back to their home, and that ended up causing the deaths of our elders. And one of the most important themes we have also in terms of values is we protect our elders, we protect our old people. We protect our young people, our babies especially, because they are our most vulnerable members within our tribe. But the reason why we do it is because they're the closest to God. The old people will be going to see the Almighty very soon. The babies, they've just came from seeing the Almighty and being with Him. So it's up to the 14 to 30-year-olds to be very careful and to show that love and respect that we hold in high esteem, high values for our tribe, the Northern Arapaho tribe. So I want to thank you. I ask everybody to be as careful as possible. If you need masks, you can come to the clinics. We have supplies. We have been distributing supplies, food and personal hygiene, disinfectants to homes that have been placed into quarantine so they don't have to go out into the public. But the key is to always wear your mask and protect others. I want to thank you, and the next few months, or 2 to 4 months, are going to be the key, because that's when the flu season happens. We're dealing with that in addition to the coronavirus. So we are faced with a double threat this winter. So our guard, our vigilance has to be at the highest level to make sure that we can keep everybody safe and healthy. So thank you.
So again, I just want to thank our Wind River Community and Healthcare Clinic CEO Rick Brandon and our clinical director Brian Olin today for their words today. And like Rick said, love and respect one another. That is our whole being of Arapaho, as elders have taught us. And so today, let's as was shared, that coronavirus spread is preventable. So we all need to do our part, each and every one of us, from the youngest Arapaho to the oldest. Let's continue to be safe. Let's keep our Arapaho people safe, our community safe. The Northern Arapaho Business Council is committed to working with our Eastern Shoshone Business Council, Fremont County, and the state of Wyoming in any way we can to keep our community safe. So again today, thank you for allowing us this time to speak with all of you. And if you have any questions, there are people at Wind River Healthcare at the clinic you can go talk to, and they can answer any question you may have on the medical side. So today, thank you. Ho ho.